Hello, I'm Brad Edwards. Thank you for streaming with us on CBS News Chicago. And it is back to school time for many, not only kids, but a lot of adults, teachers, etc. And a lot of people are talking about COVID. And a lot of people are talking about MPV. And we want to get what the latest guidelines are, what that means for you and your family. So we are bringing in a friend of the stream here at CBS News Chicago. She is also back to school today. Dr. Jessica Brinkworth, assistant professor of evolutionary immunology at University of Illinois Urbana-Champaign. Doctor, thank you for joining us today.
Yes, thanks so much for having me.
So where are we at right now? Let's break it down, kind of two different questions. These are all kind of double prongers. COVID, MPV, major concerns, and where new guidelines are when it comes to the CDC, masking, prevention, et cetera. That's kind of a load to throw at you out of the gate, but let's get right to it.
Yeah. All right. Well, so yesterday there were 8,500 cases of COVID in the U.S. that were diagnosed. It's a little bit of a drop, but currently the recommendations the CDC has made as of, I guess, August 11th is when they dropped, puts a really, really heavy emphasis on individual responsibility to self. So it relies really heavily on being up to date with vaccinations, which only protect against severe illness. They aren't mandating vaccinations for most, and they're no longer recommending screening of asymptomatic people with known exposures. And they've dropped the quarantine and isolation guidelines for those exposed. So that in combination with the absence of mask mandates in almost all settings except medical ones puts a lot of people at risk of getting this infection. One of the downsides of this, many downsides of being sick generally, but one of the downsides with COVID-19 is that we know that it's connected to a post-viral syndrome called long COVID, which does also affect kids, and it's mainly mild infections that lead to that. And so it's associated with fatigue and difficulty breathing, sometimes difficulty managing heart rate and things like that. And so, heading to school with no masks on, we're going to see a surge in cases over the next 2 weeks. And then for monkeypox, that's a whole other can of worms. So monkeypox, there's 888 cases in Illinois that have been diagnosed so far. The incubation period for monkeypox is substantially longer than it is for COVID. So COVID, you might be showing symptoms 2 to 3 days in. The average originally was about 4. That's sped up a tiny bit. And a lot of people are asymptomatic. We actually don't know as much about monkeypox in terms of how many people are asymptomatic. And we know that the incubation period can be 4 to 21 days. So you would expect, if it's passing through the school system and through daycares, then you would expect to see a surge in cases starting about 3 weeks from now.
So of the two, your greatest concern would be COVID, it sounds like?
For the time being, my greatest concern is COVID because it has the highest numbers circulating almost at all times, and it's a serious infection, at least in terms of quality of life, and it still has a large number of people are developing severe infections proportionally. So that would be my number one concern. It's also an excellent immune escape artist, and it's highly, highly transmissible. The current variant, BA.5, the current dominant variant, appears to be an evolutionary response to the BA.1 variant and BA.2 variants that circulated between December and March. And so the problem with the current set of CDC guidelines is that they kind of rely on not just vaccination, but prior COVID exposure to afford protection to people when we have evidence that that's not what prior exposure is doing in the case of this dominant variant. So that would be my primary concern. Monkeypox is moving more slowly. Severe infections can be as high as 10%, and it mainly affects kids. But in terms of kids are most often develop the severe infections. But it is moving slow, and it generally, you can get it from respiratory droplets, but it generally is closer contact and contact with bedding and other people's clothing and toys and things like that. And so I'm taking more of a wait and see sort of approach with it.
Okay.
I think it's a problem, and we're going to see a surge in cases, but I'm not as panicked about that, say, as I would be about the surge of COVID cases this week.
Yeah. So, and we know also MPV is going to stay what it is, and as you said, there is an evolutionary element, basically saying COVID is evolving and it stays one step ahead of us by creating these new variants. What then with these, you brought up something interesting I want to go back to. You were saying some of the people that show milder symptoms basically get less sick with COVID itself are proving to have worse long-term results. Like they tend to be the long haulers, as we say. So it could be mild for a couple of weeks. Oh, I got a little cough, a little trouble breathing, but then those are the ones that can last for months and months and months.
Yeah, most of the long COVID cases appear to stem from mild infections. And so it's interesting because we've had other viruses that have led to post-viral syndrome. Post-viral syndrome's been known for several decades and is a leading contender for what chronic fatigue syndrome is, right? So there are other viruses that can do this, but it's the sheer number of COVID infections and how many of them are mild that's leading to this longer term issue. And at a minimum, the average length of time for a kid with long COVID is like 5 months. We have adults where it's been going on for years. So, and there's all kinds of things that are happening to these people, and it seems to be connected to like dysregulation of cells that line arteries, among other things. And so this is a pretty serious problem. And so that's the main reason why I would be a little bit more concerned about that. But that's not to lessen the importance of monkeypox. Monkeypox will mutate too. It's just that it moves slowly and it's not as contagious. It has what we would call an R naught, so the number of cases that one case would produce is under 2, 1.8. Whereas COVID right now, the current variants that are circulating is, one case gives rise to 10. So the low-end estimate of how many cases we're going to have this fall of COVID, that is like 150 million over the course of like September to December. That's a lot of people.
That's the estimate worldwide, 150 million new COVID cases.
That's the estimate in the United States.
In the United States.
Yeah, that's an estimate the White House released in May.
Between September and when? December?
Cases from September to December.
Okay, so hit me with that stat again and say the United States, because that's kind of mind-boggling.
So the low-end estimate released by the White House in May for the number of COVID-19 cases between September and December of this coming year is 150 million in the United States.
What's that make you think?
That makes me think that's a lot of long COVID cases coming.
So we're going to have the conglomeration, too, of COVID, MPV, and then the flu. Have we ever seen a viral tsunami?
Like a Sharknado?
Yeah. I mean, kind of a triumvirate of problems.
Yeah, we've had, so in 2009, the seasonal flu was circulating with H1N1, and there's a combination of, milder end coronaviruses that have circulated before. SARS circulated with the seasonal flu between 2002 and 2004, but nothing like this. Nothing like this. And if you're up in upstate New York right now, you're also potentially dealing with polio, which has reemerged. So it's serious. This is a really serious year. The upside is that monkeypox has a vaccine. It's just hasn't been very high demand until now, so there's production ongoing. And COVID has a vaccine, and a new version of this vaccine by Moderna is going to drop that will better target Omicron variants. So that's going to drop in the next month or so, apparently. Polio, there's been a vaccine around for a very, very long time. You can, if you're not vaccinated for polio, be revaccinated. And the seasonal flu has a vaccine that circulates that's designed every single year for the 4 top predicted and 3 top predicted circulating strains. So we have prevention methods just in the form of vaccination, which puts us at a great advantage compared to where we were in 2020. The other thing is that for 3 of those diseases, monkeypox can pass by respiratory droplets. Like I said, it's usually closer contact, and the contact with crusts off of lesions and things like that. But the one upside is that certain things that we would do to prevent COVID will also lessen the chance of getting monkeypox and will also prevent seasonal flu. So masking is of great importance. Proper hand hygiene is the #1 thing between most people and these sorts of infections right now, especially monkeypox. And that would also be true for polio. So, we've got all of these things on our side. It's just an issue of implementing them.
So you're saying with this, trio of issues, I mean, it's 2, and then, throw in polio is kind of the unknown, but the remediation effort, main things would be masking and washing hands. I mean, and people are clearly fatigued by probably each, and really now there are no masking requirements, right?
No. Yeah. So I guess to that I would say this is exhausting. It is absolutely exhausting. I'm exhausted too. But the best approach to these sorts of diseases is a multi-layer sort of Swiss cheese approach, right? Which we all learned about in 2020, which is that not every layer of mitigation is perfect. So you have to put up as many of them as you can conceivably handle. Masking is sort of a low ask for most people. And vaccination, most people are able to be vaccinated as well. So keeping up with the vaccination is important for preventing severe infection, and it potentially lowers transmission depending as well. But masking and distancing does, and I'm tired too. But I was when I think about the various ebb and flows of exhaustion that I've experienced anyway since 2020, the most exhausting periods for me are the ones where the cases are the highest, when the risk is the highest, when everybody is getting sick. So we can prevent this from happening if we behave like there's a highly communicable, dangerous virus circulating.
When you talk about the another vaccine coming out, which would be what for some people the 3rd or 4th booster, or 5th shot overall?
For some people it'll be the 5th.
Okay, so let us. So just with that, if you get all the vaccines, and then you say it is, you're less likely to have severe effects of COVID, for example. Which would give you mild effects. And earlier you said the mild effects make you're seeing a lot of more long-termers who deal with the mild effects. So are those a lot of people, those mild effect long-termers, are those a lot of those number of people, have they been vaccinated to the fullest?
So that's not known, but it is known that people who have been vaccinated develop long COVID. So, it's the difference between ending up ventilated versus risking longer term complications, right? If you have the misfortune to get this infection, being ventilated, having a severe infection comes with all these long-term problems with cognition, motor movements, people suffer brain damage, there's permanent lung damage. Just the act of being ventilated is very aggressive and can damage your lungs. So, it makes way more sense to get vaccinated because most people don't want to die, and most people of this infection, and most people don't want to be in a position where they end up hospitalized or ventilated, right? So the vaccine always makes sense, but just getting the infection even vaccinated can potentially lead to these other problems.
Yeah,
it's a really, really interesting virus in that it gets its way into cells by manipulating a receptor that's responsible for managing blood pressure. And so, by the mere fact that it's getting into these cells using this receptor, we know that there's at least a short period of time where blood pressure is all of a sudden not being regulated the way that it would ordinarily be in some people. What we've seen in some of the research is that specific activity is connected to long COVID symptoms. And so it's just being in contact with it is a problem. So doing whatever you can to ensure that you're not is good for you. Doing whatever you can to ensure that you're not is good for everybody, right? And I think one of the things that's sort of missing from our overall conversation nationally about this is that reduction of spread saves other people's lives, and it improves the quality of other people's lives too. So, we need to sort of accept that we're interdependent. I can get COVID because someone else is not following the rules, even if I am.
Yeah. And it's a good point and duly noted. Do you see if the White House estimates are correct from May, and that you're saying we may see 150 million new cases in the U.S. alone between September and December? Do you see some of the guidelines changing?
I don't think anybody wants to mandate masks. But I can say that the state of Illinois has done a couple of things that are interesting given the CDC's recent guidelines. So they did this thing where they no longer recommend screening for asymptomatic people, right? They're dropping quarantining, isolation guidelines for those that are exposed. Both of those things in a backdrop where federal funds for testing haven't been renewed since the spring, or for contact tracing, like where I am, there's no more contact tracing, period. There's just, if you're exposed, you got to find out from your friends or whoever exposed you. So in that dearth of federal funding for these exact mitigation methods, one of the problems that we run into is how do you prevent it in a school setting, or how do you prevent it in daycares, how do you prevent it at work? And so the Illinois Department of Public Health has come up with a couple of things that are, I think, maybe useful that might lessen if they're followed. So in February, they dropped mask requirements in most indoor locations because of a lawsuit that led to K-12 environments and daycares no longer requiring them. But they've also taken this approach where they've decided that they're going to very actively encourage staff and students at schools to not attend when ill. So that can mean providing means for people to stay at home. They haven't been very specific about it, but they've said that they're taking this active approach. They are planning on optimizing ventilation systems. They're taking action to reinforce hand hygiene and what they refer to as respiratory etiquette. So if all of that is followed through on, then we should see a lower number of cases than we ordinarily would. But I actually think the 150 million is an underestimate because that estimate was made in advance of these new variants becoming dominant, and we know that these new variants can sidestep immunity that's been developed because of exposure to previous variants. So we're sort of at a squarish, not zero, but we're not as far along as I think most people think we are.
Far along, as you're saying, along being closer to an end.
Oh yeah, well I don't know if there'll be an end at this point, but we can certainly reduce this case infectivity rate from 10 down much lower. That's all human behavior, right? There's nothing inherent about this virus that means that it must have, like that one case must give rise to 10. It's very communicable, but we know how to lessen that communication. We could squish it down to much lower than that if we coordinate it all together. So, but right now, under the current CDC guidelines, that would require mainly goodwill.
Yeah, I don't know how much of that is out there right now, but that's a good point, Doctor. So let's go to politics for a minute. Dr. Fauci, who's kind of been the public face of the fight, long time bureaucrat, respected by many. Dr. Fauci's calling it quits, going to leave in December, the new director of the CDC. ordered a major overhaul, admitting to some pretty major flaws in the COVID-19 response. What change is this good, bad? You're not going to notice it living here in suburban Illinois, or how do you see this playing out? Thoughts on kind of this?
Well, so I think it'll be starting with the CDC reforms. So one of the problems with the CDC historically has been that it collects a lot of data and it makes recommendations. It's been active overseas and it's been active here for outbreaks of a variety of diseases, but it's a little stiff. It's hard for it to move reflexively to problems as they quickly emerge, because there had been requirements for some of its actions for certain things to be published specifically in its journals or to be peer reviewed before they would take action on them. And that process, can take a very long time. So one of the biggest changes is that they won't require that all information is necessarily peer reviewed before they consider it, which is important for a couple of reasons, including that, disease mitigation for infectious diseases in most other jurisdictions is based on a notion of like a precautionary principle, right? Which is like you act with the best information that you have in the interests of preventing something from happening. There's also a little bit more in the way of transparency being worked into the CDC system, so that's good. She'll have very specific committees reporting to her that will cover off areas that were sort of being patched together by others. So that's all good things, and I think that it'll take a little while before we see it, but we should see some changes, like a little bit more in the way of transparency and clarity around COVID management and guidelines and monkeypox stemming from this immediately this fall, because some of this stuff is literally about how do we get information out to the public. So that's really good. And then Fauci, it's sort of sad. He's 81 years old. He should have retired. He's a free man. He can work as long and as hard as he wants, but he's 81 and he still sees patients. So he still has like his own clinical practice. He's going to be stepping down in December. He's been the director, right, as everyone knows, of the National Institute of Allergy and Infectious Diseases for over 38 years. He served 7 presidents. He's also the chief of the Laboratory of Immunoregulation at NIAID. So this is one of these in-house, very powerful immunology laboratories within the NIH. And so he's stepping down from both of those positions. My understanding is that he's still going to see patients, and that I think he is also stepping down from being the chief medical advisor to President Biden. So there'll be people who are replacing him in most of those roles. I don't know what to say other than I don't know of an emerging infectious disease landscape in my lifetime without him, because he's been in this position since 1984 and he worked in the NIH before then too. And he's been so important in the development of the US's international approach to HIV/AIDS. And he's even one of the things that I think most people don't appreciate, because I think when they think of him, they think of COVID and they think of HIV, because he was really instrumental in reorganizing how HIV research was funded and how therapies were funded and developed and that kind of thing. And also he was, one of the big accomplishments of the George W. Bush administration was this international AIDS funding initiative to go treat people overseas. And he was the guy that designed that. But he's also developed therapies for special conditions, rare, but it's called granulomatosis with polyangiitis. It's GPA is the short version of it, and it's when blood vessels become inflamed. It's a very dangerous condition, and he's made drugs and things like that to treat it. So that's quite a career, and he's really good at managing people. And generally a friendly person. So it's sort of sad to see him go, but the NIH doesn't have very many people in his position that represent, say, the rest of the United States, right? And so it might be really nice to have someone new in there that's represents, say, people of color, or can respond to some of the other concerns that may come to NIAID a little differently. Francis Collins, when he stepped down earlier this year, was talking about how they never, in his view in the NIH, he had underappreciated, so he was the director of the NIH previously, he had underappreciated the importance of social, and sociocultural concerns in infectious disease, that he thought of things in terms of either behavior or in terms of immunity, and that it was really, really important to have a behavioral component worked in, and NIAID could use some of that too. And so I think that it would be nice to have someone new too.
Yeah.
But I wish him the best. He's a
huge
nice
shoes to fill.
A great scientist.
Let's go back to topic A. COVID, MPV, you throw the red herring in there that is random polio cases, in a 20-second takeaway, parents sending their kids back to school, no mask mandates out there. What is a parent to do who's sending their kid to school today to keep them healthy? Your advice.
Okay, make sure that they're vaccinated and up to date on their vaccines, and that they complete the complete course, right? So for kids that are 5 to 11, I believe that that's 2 shots, and for 5 and under, it's 3. Mask, the place that they're going to catch these diseases are in the lunchroom and in play areas. So ensure that they are eating, that they're masked at lunch, or that they're eating distanced, and that they wash their hands. Hand hygiene is everything. So that's what I would suggest.
Okay. Dr. Jessica, certainly not a Pollyanna prognosis. I think it's a little more dire than I thought it would be, but we really appreciate your honesty and the information you bring to the table. Professor of Evolutionary Immunology at University of Illinois, Urbana-Champaign. And to you, welcome back to school. It is your first day as well. Here's to a fruitful, safe, and healthy year. Dr. Brinkworth, we thank you. Friend of the stream, we will have you back on, no question about it. We thank you for joining us today. Now back to the stream.